name is John Ombogo. At Ambulex, I serve as a public sector and partnership lead, whereby I am focused on partnerships, stakeholder engagement, and building relations with counties. So my work entails working closely with the county governments in Kenya, and also working closely with partners who are in health innovation, and also who are in work streams that are aligned to emergency evacuation, GBV, victim evacuation, and supporting counties in terms of aligning in their emergency operation centers and units within the counties. I'm always driven by meaningful impact, creating meaningful impact in the community. So I'm a trained health professional. I've been worked for 15 years supporting NGOs in the country and social enterprises. So I'm delighted to work with the health sector, because that is my area of profession and my areas of training. Is that I'm interested in terms of leading all manner of literature that are health related. So I read through medical journals, written articles on health, and an array of literatures that have been published, documented, and readily available now that we're in the era of artificial intelligence. So I'm utilizing that to learn what other countries and other individuals, scholars are doing all over the world. No two typical days look the same. Each day presents with a number of challenges and a number of engagement within the sector that we're operating in. Major days we look in terms of relation building, follow-up engagement, virtual calls, planning for meetings, and engaging a number of stakeholders that are working in the emergency sector. So the days dynamically don't look the same, but they try to be similar in terms of the stakeholders that I'm engaging, but we engage them in different work streams. So that is how my typical days looks like, engaging internally and externally to make sure that all work streams are aligned. Public sector and private partnerships play a critical role in terms of resource mobilization and working closely to reduce duplication and maximize on resources that have been allocated. So PPPs, that is public-private partnerships, will improve in terms of our approaches, will harmonize our and synergize our efforts, so that now we are able to amicably agree and have a greater impact than working individually. So this pooling of resources into one pot enables counties, enables the government, enables the region in terms of East Africa to be able to implement what a single entity cannot be able to implement. So this alignment between public and private sector harmonizes our strategies, our innovation, our objective, our vision towards safeguarding the individuals in the health sector, and also more so in terms of emergency evacuation, GBV protection, and be able to scale. Yeah, emergency preparation is key, because I've witnessed this in a number of scenes that I've experienced in my line of duty. So having worked right from the university after graduating, going to internship, I've seen emergency situations that needed a prompt evacuation that led to loss of lives. So there is a number of events that I can be able to mention. There are so many road accidents that I've witnessed in terms of, if we had emergency evacuation, if we had a prompt response, if we had a number that you can call and get emergency evacuation, we will have saved some lives. So this happens within the facility in terms of delayed referral system. Maybe somebody needed to be referred from one hospital to the other, delays of ambulance, the ambulance is not well equipped. So this emergency preparation is critical in terms of saving life and ensuring that we are able to utilize the golden moment to save a life. Right. Yeah, the future of Ambulex is bright, working in the health sector, because health innovations are now integrated in terms of the artificial intelligence, because at Ambulex we're using artificial intelligence for dispatch, and we're using artificial intelligence in other spectrum of works that we do. So the future of Ambulex, and what excites me most in terms of the impact that we are creating, saving life, GBV evacuation, so working closely with the county government, national government. So this alignment will be able to see as impact in terms of saving life in the community, and making sure that the community is sensitized in terms of preparation, disaster preparation, GBV sensitization. So this line has not been tapped for quite some time. So tapping this, we are able to make sure that the community is aware, is prepared, and they are evacuated when there is need. Emergency preparedness, what I need Kenyans to know is like, you need to have that one number that you are able to call and you are able to be responded to. And that number is Ambulex number, which is 0702898989, whereby you can call that number and you are evacuated. If you are a GBV victim, you can be evacuated. If you have an emergency, let's say fire, you have an accident, you can be evacuated. Maternal, if you are pregnant, you have seen danger signs, you're able to call that number. So utilizing that golden moment to save a life is key to me in terms of preparation. We are reliable. If you call us, we are able to respond within minutes. We are there. What's up? I'll shut my eyes. Definitely, we are able to mingle. In my house, there's a lot of restriction, kids here and other operations that are happening in the house. We believe in reliability and we believe in impact.